2nd, 2022 regular but remote meeting of the Burlington Board of Health to order. We are not remote because of the pandemic this evening. Things are better. We're remote because of the not because of the pandemic. We're remote because our meeting space is undergoing a very much needed renovation, and we will be live again in March. Please join me in reciting the Pledge of Allegiance. I pledge allegiance
to the flag
of the United States of America
and to the republic
for which it
for which it stands, one nation,
under God,
under God, indivisible, with liberty
and
and
justice
for all. I'm Dr. Ed Weiner, Chairman, and with me tonight are board members, Vice Chair David McSweeney, Dr. Wayne Saltzman, Andrea Sheehan. Mary Beth Welch could not be with us this evening. Also with us is Susan Luminello, our Director of Public Health, Michael Green, our Associate Director of Public Health. Sarah Cordomash will be serving as our Administrative and IT Specialist and host, and Recording Secretary this evening will be Dawn McDowell. Please note that we're live on BCAT and available for appropriate comments and questions through this terrific technology. Now, please note that remote meetings are always more difficult. We ask for your understanding.
Mr. Chairman, I'm sorry to interrupt you. I just want to make note that I don't see Board Member Sheehan on the meeting. Only because you called it out. I just want to make sure that that's.
Oh, I thought
accurate.
I saw her.
Unless I'm missing her, but I don't see her.
I don't see her either, Mr.
Yeah,
McSweeney.
I spoke to her this evening, and she said that she would be here. So I don't know. Would
Well, currently you have a quorum, so
Yeah, we can continue. Yeah.
All right. She is not here. Now that I'm looking again, she's not here, but she said she would be. So she'll join us. Citizens time. Is there anyone here who is not on the agenda who would like to speak to this board? Do you see anybody, Sarah, online? Oh, there she is. Andrea Sheehan. I told you she'd be here. Sarah, is there anybody online? She is saying no. So we'll move on to approval of minutes, January 25th, 2022. I have one correction. Does anybody have anything? My one correction is on page 4 under Dr. Under Dr. Saltzman's motion. It should read, Dr. Saltzman moved that the Board of Health recommend maintaining the mask. It should be advisory for the vote, advisory for the town of Burlington. And if you look down, it says at the end, Dr. Weiner stated that the advisory remains in effect. So would you please change advisory, mandate to advisory?
Yes, I will. Thank you for that.
Thank you. Yes, see, we read them. Anyway, I'll put it to a vote. If nobody else, does anyone have a motion, please?
Mr. Chair, I'll make a motion to approve the meeting minutes for.
Motion by David McSweeney. Second by
Wayne Saltzman.
Dr. Wayne Saltzman. All in favor? And I have to go through the list. David McSweeney.
Aye.
Dr. Wayne Saltzman.
Aye.
Dr. Andrea Sheehan.
Aye.
And I vote aye. That's 4-0-0. Thank you so much. Chairman's report. Well, thank you, BCAT, for televising this meeting. Again, we are not remote because of the pandemic. Things are getting better. We are remote because our meeting space in Town Hall is undergoing a very much needed renovation, and we will be alive again next month. As I do each meeting, I want to acknowledge our professional staff, our Board of Health members, and all town departments for their commitments to this community. As you know, the Board of Health has and continues to work in keeping Burlington safe and well, especially during this more than 2-year unprecedented time. And I'm happy to say it looks like our pandemic is quickly becoming an endemic situation. Our lives are beginning to come back to normal, and hopefully COVID soon will be just a memory. For the Board of Health, in addition to our major COVID-19 work, I'm proud that we have always fully completed all the necessary public health program and requirements, including development and redevelopment, remediation, land use, drainage, and flooding, and the establishment of biotechnology within this community. Tonight, much of our meeting will be focused again on biotechnology in and for Burlington. You may have seen my comments supporting this concept at town meeting last week. On behalf of the board, as things appear to resolve, I thank you for your support. I thank the community for their support. And always, if you have any questions, you want to discuss anything, our website is a great resource. And most important, we, all members of this board and its professional staff, is only a phone call away. I'll leave it open. Would any board member like to make a comment?
Mr. Chair, may I make a comment?
Please, Dr. Salzman.
Thank you. Mr. Chair, and our board and staff may have read in the Boston Globe over the weekend the tribulations of our fellow boards of health across this state, and the stressors that they have felt and manned throughout the pandemic, but have left many of them quite distraught and even have led to resignations. And Mr. Chair, I would be so bold as to offer the support of the Burlington Board of Health and understanding to our fellow boards of health across the state, recognizing that stress. So I am thankful that during our deliberations with regard to mitigating COVID-19 in our community, that our citizens were fair and allowed for good discussion. Thank you, Mr. Chair.
Thank you so much, Dr. Salzman. Anybody else have anything like to add? Just a tribute to this community that everybody was respectful in all of the discussions we had. Thank you again, Dr. Salzman. Which brings us to applications. Our first is for Burlington Woods Drive, application of a minor engineering change, an application for approval of a special permit. I guess our new Director of Public Health, Michael Green, will be presenting this to the board.
Correct, Chairman. This for Burlington Woods Drive, this is an existing building that was originally proposed for BioLife Sciences back in 2018. Right now they're fully tenanted out with Cambridge, Protogene, and AltaView is on the way to come in, so there'll be 3 tenants for this building. The tenants will be managing their own chemical storage and waste storage for this site, but the owners managers, the Gutierrez company, they will be maintaining the pH neutralization in accordance with the MWR permit, MWRA permit with their common feed system, and they're going to be assisted with the management of that by PPM Incorporated. Very similar setup to their 10 corporate drive that was approved. They did also have a minor engineering change for a fenced and concrete pad installation for liquid nitrogen tanks. The pad, the fencing, the bollards would be installed by the owners, managers. The tanks would be installed by the tenants when that comes up for review.
Thank you. Who is representing for Burlington Woods Drive?
How many people are there?
Good evening,
That
Mr.
would- How are you?
Good evening.
That would
Mr.
be me.
Who
Sorry?
is me, please?
Dorothy Harding,
Thank you.
Horizon Interiors.
Please. Can you present this to us?
Yes.
Anything else to add from our associate director's presentation?
So currently the woman that lives there, oh my gosh. The
May I interrupt for a minute, Dorothy? This is for Burlington Woods.
Oh, I'm sorry. I thought you said for Sunset.
No, not yet.
Okay, I'll go away.
It's okay. Thank you. I was really confused there for a moment. This is Scott Weiss with the Gutierrez Company. I'm here tonight representing building ownership and management for 4 Burlington Woods Drive. We appreciate all of the work of the Board of Health, its representatives, and staff, and certainly staff and Mike Green, and welcome his addition to the staff, and worked with him to review the materials here with him, as well as the director and the environmental engineer, Susan and Christine Mathis. As Mike indicated, the building has been previously approved for use for lab tenants. The conversion of the existing office building has been completed, and build out for the tenants in the building is currently underway. As Mike indicated, there will be 3 tenants in the building: Protogene, Altaview, and Cambridge. That's C-A-N Bridge, not C-A-M, as in the whole community nearby. So those 3 facilities will be in the building. 2 of them, Cambridge and Protogene, construction is currently underway. As indicated, each tenant will be responsible for the oversight and management and storage of their individual materials, chemicals, and the like, and their processes. However, there is in the building a centralized wastewater disposal and pH neutralization system. We have gone through and submitted application, and actually have just received the permit from the MWRA for that system as well. That provides for discharge to wastewaters of very limited amounts of any materials. Really what happens is, as part of the process, and many of you with the doctors at the beginning of your name probably are already fully aware of how this works, but for any disinfectant that does end up going down the drain, most everything else is restricted. That is neutralized with a pH system before it is discharged to the sewer system. It is monitored, it is tracked, it is has oversight by our contractor, PPM. The only chemicals that the management therefore has control over are the acid and base materials for that system. 4 Burlington Woods Drive is a 4-story building with a parking underneath. The pH neutralization room is located in the basement level where the parking is. And with the chair's permission, I'll share my screen to show where that is located. That's okay. course, I can no longer see anybody else. So if somebody can confirm that they can see my screen, that would be
Yes,
helpful.
we do.
Excellent. Thank you very much. So I can see people. See my screen. So as I mentioned, this is the lower level of the building itself. There's parking underneath. There are some walled off rooms. There is a loading dock located on the left side of the building. And then on the bottom right wing, if you will, is the pH neutralization room. There are 2 cabinets in there for feeds into the neutralization system. They both have, I believe it's 110% spill storage containment within it, and allows for the system to operate from that point. There are no other chemicals that the management will be overseeing as part of this system. With that, I'll take a quick pause before I turn to the outside of the building and the request for the fenced area and concrete pad area. See if there are any questions specifically about this component.
Does anyone have any questions on the board or our professional staff? Is the system alarmed so in case it fails?
That is a great question, and yes, it is. It's alarmed both locally and is tied into a dialer to send out both text and phone calls to both our building management staff and our contracted representatives.
Okay, thank you.
Mr. Chairman, just one question. Mr. Weiss, thank you, and nice to see you. In my tenure here on the board, I haven't seen this before, but can you talk a little bit about the permit you need to obtain from the MWRA, and what's that all about? Just for is it for the discharging of the pH neutralizer?
That is exactly it. In fact, and I'm sure either Susan or Mike who are on could probably comment even further. Every facility in town that has lab activities most likely has, maybe not every single one, but anyone that has a sewer connection and lab sinks for cleaning and the like are required to have an MWRA discharge permit. So this is not unique here. What may be more unique is this is the only thing under the ownership management purview here, because it's multi-tenanted in this building as opposed to under the purview of a single tenant. And that may be one of the things that is a little bit different than some of the other existing facilities as you go through. So I'm sure Susan, I know Mike maybe he hasn't been through all the other permits as of yet, but could probably comment about the fact that there are a number of other MWRA permits that already exist in town. Susan,
Yes, actually, to that point, Vice Chair, I did just go out on an inspection over at Curia and saw their pH neutralization. Azure, their pH neutralization system, and they do something similar where it's a common feed from multiple different laboratories that they treat. They have testing on site, and then there's testing by MWRA further down the line. If it's over, I believe, 9 pH, then they'll add sulfuric acid to bring it down. If it's under 5 pH, they'll add sodium hydroxide to bring it up. So that's how they're monitoring it in-house. If they get any complaints, they'll know exactly what's going on, because that is continually monitored and logged and tested.
Great. Thank you. Appreciate it.
Have the tenants been before the board yet? I didn't catch all the tenants that are going there for the health biological safety regulation.
They have not, Dr. Weiner. They have been some of the build out has started. They are compiling all of their information. I believe at least one of the tenants, Protogene, which is sort of the furthest along, has reached out, had a conversation or two with actually both Protogene and Cambridge have had some correspondence, I believe, with Christine Mathis. Don't want to speak for her, she's not here, but I know I've been copied on some of the correspondence and sat in on at least one discussion.
Outstanding. Thank you very much. And I'd like to ask my staff just one thing. I'm very excited about this, but this is a special permit. I'm sorry. Yes. No, I'm sorry. It's not. It's an approval of a minor engineering change and special permit. Is it the minor engineering change? Is it what kicked that in? Because is that the build out? Or is that the use, or why is it a minor engineering change? I'm just curious. I know that's a catch-all.
Mr. Chair, I know there's a question to your staff, but I'll just jump in. I only talked about the sort of special permit element of what's in the building. There is a change to the site plan that's outside that I could, that triggers the minor engineering change.
Would you show that? You were going to do the outside anyway.
Yes.
Thank you.
Yes, sir. Okay, see if I can switch plans here. Okay, we're now able to see a new plan. So this is the outline of the building that's there today that we were talking about. The PH room is over in this corner. The details within the building are not shown on this plan, which is a site plan that shows the parking and the access. The area of changes that we're talking about outside the building are in here, and I'm going to zoom in this area. So this is adjacent to the loading dock that's there today. There is a sort of gravel area next to the loading dock and between the stairway that goes up to the first floor level. The loading dock is below at a lower level. And in this area between the stair and the loading dock, we propose to have a fenced and bollard protected concrete pad that will allow for the addition of LN2 tanks in this location. Two potential LN2 tanks are being envisioned there, one for each of two tenants, Protogene and AltaView.
And what will those contain? Liquid
Nitrogen.
Liquid nitrogen. Okay, fine.
Yes.
All right. Does anybody have any more questions, comments, either professional staff or the Board of Health?
Yeah, hi, this is Susan. I just want to make sure that you can hear me. I was having some audio issues. Can you hear us?
Yes.
Yes, we can.
Okay. Was there any other additional questions about the MWRA permit, or was that question answered?
No, thanks, Susan. It was clearly answered, so appreciate it.
Okay. If there are no other questions, no other comments from anybody, is there anybody online who may have a comment? Sarah?
None that I can see.
Okay, so what's the pleasure of the board? Do I have a motion for approval?
Mr. Chair, I'll make a motion to approve application for approval minor engineering change and approval for the special permit for Burlington Woods Drive.
Susan, do we need to do those individually?
You could vote together on it for both the special permit and the minor engineering change, since the conditions are the same.
Okay.
Second.
I have a motion by Mr. McSweeney, second by Dr. Saltzman. All in favor? Mr. McSweeney?
Aye.
Dr. Saltzman?
Aye.
Ms. Sheehan?
Aye.
And I vote aye, 4-0-0. Thank you so much. We very much appreciate you coming, Scott, as always, and you have your approval. Very exciting stuff.
Thank you all, and thank you to the board for their continued hard work and support of the life sciences in Burlington. It's great to see, you know, some new groups coming in between myself and I know the next discussion perhaps that you're going to have. It's really exciting to see the progress within the community.
Thank you
for
very
your
much.
support.
Good. We look forward to your attendance. Application 27 Network Drive application for approval of a special permit. Who is going to be presenting that? Is that our associate director too? I see Susan.
Correct, Mr. Chair, it'll be me. I got lucky on today's meeting. So this special permit for 27 Network Drive, this is the Broad Institute of MIT and Harvard. This is a new construction that was approved by planning in 2021, the Nordblum Company, bringing in, I believe, both 25 and 27 Network Drive. Major concern here is going to be well, not the major concern, but the Broad Institute's moving their functions, their major functions, their genomics platform to Burlington from Cambridge. And that includes a bunch of design, data generation, and method development here. And in the course of their work, they will be a large quantity generator of the hazardous waste that will be regulated by their HMRF. We do have preliminary plans for first, second, third floor, and some exterior finishes on the building, but those fine tuning elements are still coming in to us, and we'll definitely have those before we go forward with our biosafety special permit. We have proposed conditions similar to our last presentation, and if you have any questions, let me know.
Thank you. Who is representing the proponent? I assume Mr. Buckley.
Good evening, Dr. Weiner. Your assumption is correct. And members of the board, for the record, Robert Buckley, Reamer and Bronstein. I have with me this evening Sarah, is she on here? Yeah, Cartet from the Broad Institute, and Todd Fremont Smith from the landlord and the developer. If you recall, as Michael indicated, about a year and a half ago, we approved a building at 25 Network Drive with the idea of essentially having a structure that would be two sides to accommodate two life science tenants. They're essentially mirror images of each other. That was approved in terms of all of the components for the construction of the building. As part of that permit, there is a requirement that as users are identified, they come to the Board of Health for review of their operations. And if we need additional permits, now that we just went through this, as you recall, with Varicel, this would be on the other side. We're here this evening for two special permits under the PDD bylaw, which is the hazardous materials for primarily the generators that will be installed, and in excess of a very small quantity generator of materials in connection with their operations. You know, we've worked very closely with the staff. We had a DCM meeting this morning. We went through all the town comments, but before the planning board, I believe next Thursday evening. And we'd welcome any questions you may have. I think echoing what Scott said on the prior hearing, this is very exciting. This is a world-renowned institution coming to Burlington, and Sarah can comment on that, but we're excited, and we're excited the fact that they were attracted to Burlington. I think, Sarah, you said this morning you looked at approximately 40 sites, and Burlington was the one that was chosen. So, Sarah, I'll turn it over to you if you'd like to just give an overview of your operations and what you'll be doing here in Burlington.
Yeah, thanks, Bob. So we are at the Broad Institute of Harvard and MIT. We are looking at the future of human medicine with an eye to genomics. So specifically, we're relocating our genomics platform to the Burlington campus. They are actually the largest producer of human genomic information in the world over the last 10 years. So I think this is a really kind of exciting historical event for us to be moving out of Cambridge for the first time. So I'm happy to answer any specific questions about operations, but I think Bob did a great job outlining basically what we're looking at.
Well, I can tell you as a scientist and that I'm well aware of the Broad Institute of MIT and Harvard, and we are very happy that you've chosen this community. You have a worldwide reputation. I'm sure that every I will be dotted and T will be crossed, and you'll have all the information to us by the time that it'll need to be before us with our biotechnology regulation. And I think you've seen it. I'm sure in doing your due diligence, you've seen it. I read your background. You produce 1,900 tetrabases of genomic data per month. That is unbelievable. And we're very happy that you will be here and you're coming to Burlington. Does anybody on the board or our professional staff has any more questions? You note that the conditions are very much like the conditions for our previous applicant because they're not ready to move in tomorrow. But they will be before us for a review of their biological safety regulations prior to coming to the community. So does anybody else have a question?
Mr. Chair, I don't have a question. I just have an additional comment to yours. I think many people today have learned of the Broad Institute from its significant impact on during COVID-19 with regard to testing, especially. But I just think this is an absolutely wonderful and frankly amazing coup for our community and a true testimony of what all our professional offices have been able to do in order to create an environment that not just the Broad Institute but other biotechnologic institutes have come to our town as well. So just general kudos to everyone. Thank you.
Mr. Chairman, may I make a comment?
Sure.
First of all, I want to thank the Board of Health because from day one, years ago, they picked up the banner and were the ones who carried it forward so that the community was educated. And I saw you at town meeting the other night, and I thought that was a good summation of where we were, where we are, and where we're going. So I want to compliment you on that. Your staff has worked exceedingly diligently over the years to bring us to where we are, so that the program is understood. It's the professionals ask the right questions, and the quality of the users coming to the town right on their game, and as you said earlier, dot every I and cross every T. So there's tremendous control and oversight. So it's a lot of work that goes behind the scenes to get to a 15-minute presentation before the Board of Health, but hours went into this, and for that, we're very thankful.
Does anyone have any other questions? Representing the Broad Institute is Sarah Collette, correct? Quartet.
Mm-hmm.
I'm sorry, I mispronounced your name. It's tiny. It's very tiny on the screen. I'm going to ask for a motion, but before I do, Ms. Quartet, would you please do me a favor, do the board a favor? When you go back to your leadership, would you let them know that we are very excited that your institute is coming to our community? We have quickly developing an advanced scientific community here in Burlington, and we are very proud that you have chosen Burlington. So would you please communicate that back to your executive team?
I am more than happy to do that.
Thank you very much. Do I have a
Mr. Chair,
motion? Yes,
Mr. Chair, I'd like to make a motion to approve the application for special permit 27 Network Drive, the Broad Institute of MIT and Harvard.
I have a motion by Dr. Wayne Saltzman. Do I have a second?
Second.
I have a second by Vice Chair David McSweeney. All in favor?
Aye.
Well, I've got to read them by law. Mr. McSweeney,
Aye.
Dr. Saltzman,
Aye.
Ms. Sheehan,
Aye.
and I vote aye. 400. Welcome to Burlington.
Thank you very much for your time and consideration, and please, everyone stay healthy.
Thank you so much.
Thanks, Bob. Thanks, everybody.
Thank you.
We are now at discussion for Sunset Drive plumbing variance recommendation. I know we have someone to speak on that.
Yes, this is Susan. So Dorothy Harding is the designer of the property, and she's here to speak on it. The owner of the property is Mrc Rise, and she did send me an email saying that she was aware of Dorothy coming to this meeting and that she was going to be her representative tonight for this recommendation on a plumbing variance. And the variance that they are seeking is for a shower drain. The requirement under the plumbing code is that you have a 2-inch drain from the shower. They're going to try to make they want to get the variance to make it 1.5 inches. The recommendation, I did speak to the new plumbing inspector, Joe Marabella, and there's some information in your board materials that he provided to us regarding this and regarding the comments from the plumbing board on this type of request. Evidently, it's a fairly common request. The reason why the 2-inch drain is required in the plumbing code is because so that the bathroom floors don't get flooded. So in the past, the the state plumbing board has required there to be a higher lip, and I believe they're going to do that. But one of the, I do recommend that you vote in favor to provide a favorable recommendation to the plumbing board, so long as that there's only one shower head in the shower. I'll let Dorothy make any other comments on that.
Now that it's actually my turn. Marcy's basement is completely done, and I was down there the other day, and everything is hidden behind a wall about 4 feet in. So we would have to tear her bathroom apart downstairs in the basement to do this. But basically it is just a formality meeting with the board. Her tub will be converted to a shower, 1.5-inch drain remaining. And instead of a 6-inch curb on the inside, the curb will be 8 inches on the inside. And Marcy's aware of this. And then also the fixtures are 2.5 gallons per minute, which is required by the variance board, or plumbing board.
Ms. Harding, what is your role here? I could not hear Ms. Luminello.
I'm actually the designer and the project manager doing the construction for Marcy.
Well, I'll tell you, I've been through all of this. I have no objection whatsoever. I just want to make you aware, as you probably know, that we're making a recommendation to the plumbing board, and they will take it under advisement, but we don't have the last say. We
Right.
can vote in favor of it, and you can take it to them, or we'll submit it to them. But I'm not sure if they'll approve or disapprove, but I am in favor of it.
Mr. Chair,
Yes.
I just want to add that the Board of Health is not a formality in this issue. The Board of Health is a required step in order to make sure that we're advocating for safety under state laws to the plumbing inspector. So I would say that this is a purposefully deliberative discussion that we are having.
Thank you, Dr. Saltzman. Which is true. Right on the button. Thank you. Does anyone have any questions at all for the proponent?
I don't, and we don't need to vote on this, Mr. Chair? Or
No,
do we?
no, you do, yeah.
We do.
Okay, so Mr. Chair, I will make a motion then to send a positive recommendation to the plumbing board for variance on 4 Sunset Drive.
Second.
So I have a motion by Mr. McSweeney, second by Andrea Sheehan. No other questions, discussion? All in favor, Mr. McSweeney,
Aye.
Dr. Saltzman,
Aye.
Andrea Sheehan,
Aye.
and I vote aye, 400. You have your recommendation. Now, Susan, do we send something or do we?
Yeah, yeah, so there's a letter that I will email to you and Mrc, Dorothy.
Thank you.
Yep.
Thank you for coming, Ms. Harding.
Thank you very much. Sorry for the earlier interruption.
Not a problem. I hope you're successful.
Thank you.
2022, 2023 flu vaccine purchase. As most of you know, my son is a high-level executive with Sanofi, and therefore I have recused myself. Although we're not going to be purchasing, we may be voting on it. And since then, since we've mentioned in the paperwork Sanofi as the possible vendor, I am going to recuse myself. So, Mr. McSweeney, would you please take over?
Certainly, Mr. Chairman. So Susan, it looks like you have provided information. Do you want to kind of go through your report?
Yeah, Chris provides
Chris
it, so
Fox?
she can, yep, she can do the overview.
Hey, Chris.
Hi. I know I haven't been here in almost
I
2
know,
years.
long time no see.
Hiding in my office doing COVID. Nice to do something different like flu.
There you go.
Anyways, I put this memo together just to give you an overview of the cost with Sanofi. We haven't received any other information from any other vendors at this point. So we went just kind of put this together just to give you an overview of what we're thinking of purchasing for this coming year for flu. And I also put some graphs on here as well to show you the last 3 years of our flu clinic. And then if you look on the second page, the last 4 years of age groups that we have seen with flu. And right now, I just checked today, we do not have an updated ACIP recommendation for flu this year. It usually doesn't come out until the end of the summer. For some reason, it just keeps getting later every year. So I put the 2021 to 2022 ACIP recommendations for flu, and I'm sure Dr. Saltzman may comment on that because again, it's really the flu would be for 6 months and up at this point. And if you look on the 2021 on the first page where it says 2021, 2022 flu season, basically the Board of Health purchased Flu Zone. We purchased multi-dose vials last year because we had so many syringes, combo syringes left over from the previous year. And we usually use those for our first responders. So we used up those. We had also ordered pre-filled syringe, flu syringes, which is 550. We used up most of those, and we also ordered 170 doses of the high dose, which is also pre-filled syringes. And we did receive 40 doses from the state last year. Not too much is going back this year. And we do get a 10% refund on a certain amount, 10% of whatever we're returning to them, which we will be getting the full refund this year. And also, if you look under the recommendations for flu season for 2022 and 2023, I don't have multi-dose vials on there because they were also, last year, they weren't able to give us 550 doses of the pre-filled, but this year they are. And so I'm recommending that the board purchase the 550 pre-filled syringes this year, not any multi-dose vials. And then also 150 doses of the high dose this year versus 170. And the reason why is because last year we had about 15 to 16 doses go back. We didn't have any high dose flu clinics. We only gave that out at the flu clinic. So we're going to see where we're falling this year. If we're trying not to return any high dose if we don't have to. So we lowered that by 20 doses because we do have about 20 doses going back to them. And then also we're receiving 40 doses from the state, which is part of the VFC program. And that's free from the state. We did end up having to return back about 15 doses of that this year. So the cost is on the last page. These are pretty approximate because they do provide some discounts for us. There's also a pre-booking discount. Those are not added in. It's this approximate cost, but it's pretty much spot on. And then on the last page is when we're going to receive our doses. So it looks like we're going to receive about 50% of them in September. The high dose, 75% in September. And then we should receive all of it by October, so hopefully right before our flu clinic.
Mr. Vice Chair?
Dr. Salzman, I was just about to get myself off mute. Thank you.
So, Chris, thank you so very much. So, this year was another strange year with regard to influenza. It has tapered down to a trickle. Many people have called the season over, but with mask mandates and other social and the other social precautions for COVID seemingly waning, we may have a bit of a resurgence in flu. I would say let's wait and see. But so Chris, I definitely agree with your thinking with regard to the pre-filled syringes. My concern is next year possibly being a much tougher year when it comes to the flu. And so I would argue, but we can discuss it further, but I would argue that that we should still have those extra high dose vials, but or high dose or high doses, but it's not worth quibbling over. I am concerned about next year and wanting to make sure that we do have a sufficient supply.
Dr. Salzman, yeah, I was thinking, and sorry, Chris, I'll let you respond to this. Like, I was actually thinking the same. And Chris, thanks for the overview. It was very detailed, so I appreciate that. So, Dr. Salzman, I was thinking the same as Chris was going through her discussion, in that I don't know, well, none of us do, right, what the flu season is going to look like next year. And I guess my gut is telling me that it might be worse than what we've seen in the last couple of years. And I don't know if we want to, and again, we're maybe just mincing numbers, right? Or splitting hairs, but I might want to err on the side of being over prepared versus under. And I guess my question is, it seems like, and Chris, I'll let you respond to Dr. Salzman too, but my question is, it seems like we're placing an order now for fulfillment in September and October. What is the, and Susan, I know you want to comment too, but what is the opportunity to add more to the order and get it in time for, to impact flu season this year? Maybe not necessarily for the flu clinic, but to be in time to really impact flu season.
So we, when I spoke to the rep, she explained to me that they extended the ordering process this year. So the pre-booking, we can book up until March 13th. Now, we're not locked into that, and we also can order more. It's just that we'll have to take what they have after the fact. So if it's multi-dose vials, then it's multi-dose vials. We have plenty of syringes that can cover that. The high dose, we can put another order in. What happened last year was the fact that we didn't have any high dose clinics. So it was hard to really gauge because whatever was left over from those clinics, we took to the flu, we would have taken to the flu clinic, but we had none left over the year before. So this year, because of COVID, we didn't have those flu high dose clinics. We
Right.
took all the doses that we had to the flu clinic, and we had about 30 going back. So you're right, David. It is very hard to kind of, find out where we're going to be after the flu clinic. We still should be able to purchase what, if we needed some extra doses to do another clinic if we had to. But I'm not sure, we don't have a date yet for
Right.
our flu clinic to see where we're going to be actually and what we're going to have left over. This may be, you're right, it may be a flu season like never before. Because again, by this time this year, this year right now, I usually have about 170, confirmed cases of the flu. I'll be honest with you, it's been under a handful.
Right.
So is it COVID? And you're right, Dr. Salzman, is it, people washing their hands, they're wearing masks, they're, social distancing, things like that, has a lot to do with it. And you're right. Now that everything's open and mask mandates are lifted, we could be hit, but she was pretty confident that we'd be able to order more if we needed to.
So this
Susan,
is
go ahead.
Susan. Yeah, I just want to comment. So
And Susan, if you can talk when you afterwards, can you just comment on how much we can return to the state if we over order, or what that buffer zone may be?
yeah, so the reason why we do this, why we're pre-ordering, is because when you pre-order before a certain date, sometime in March, I believe it's the 13th, you can get reimbursed for those amounts by 10%. So if we order 550 doses of the the pre-filled syringes, then 10% of that amount we get reimbursed if we don't use it. So that's why I like to put in a pre-order. So there's some different things that we need to consider though, and that is how much time, first of all, I guess, would be how much time we want to spend on giving out flu vaccine. In the past, the board has always said, well, we believe that the EDS is what's important here. You can go to CVS or your doctor's office to get a flu. We're doing it because we're doing it to practice our EDS. So when we do our EDS, we give out about 550 doses in that 3-hour time frame. And that has really been consistent over the years. In addition to that, we do like to do something for our first responders and employees. So we considered that, added a little bit more in for that. So this amount is for covering that. If we want to do more flu clinics, then yeah, we would need to have more flu vaccine and we'd have to dedicate more time from our staff to give out flu vaccine. So that's a question of, what does the board, how does the board want us spending our time? How do they want the nurse spending her time? Are we going to be doing, tons of flu clinics? Or are we just focusing on the EDS as a practice for our volunteers, a practice for Board of Health staff and board members in giving out vaccine in emergency? And that's the way I've always looked at it in the past, rather than running, a flu clinics all season. So there are certain things that we do like to do, and like I said, that is for the emergency responders. So this is the amount that we would need for that. Now, if we change our mind and we have, flu is prevalent and we need more flu vaccine, there is the opportunity, or could be the opportunity, to order more. Sometimes in the past they have it available, sometimes they don't. Sometimes we might just go to a different vendor. I remember one year we didn't have it from Sanofi.
Yeah.
We bought it from somebody else. So, we don't know whether or not it's going to be available or not. We can't say. This is all guesswork, and it's guesswork every year. And these past couple of years, it's been more difficult to try to determine how much flu vaccine, what the flu season is going to be like because of the conditions that we're in. So we don't want to order too much, because if we order too much, we can only get reimbursed for a certain amount of that. then we have flu vaccine that expires that, we can't do anything with. So that's my concern about adding to this. And as you can see, the high dose vaccine, is pretty expensive. And we're constrained to what's been allowed for spending from the revolving account by town meeting. So we can only spend a certain amount of that revolving account anyways. So I like to be a little bit conservative with that.
Susan, I have a question. When we use the color platform now, people that sign up for the high dose, is there a way that we can estimate how many people will sign up for high dose before that clinic? And if available, if there was a need and calling the Board of Health and wanting to get on a waiting list, maybe possibly ordering as per dose per person that's calling that wants to reserve for it.
I mean, that's something that we could try, but the only problem with that is what we've experienced in the past is when people call to get on a waiting list and then we order it, they won't wait to get it here. If they can get it at CVS or get it at their doctor's office, they're going to do that, and then they just don't show up here. And then we have those remaining doses that we now paid for and can't get reimbursed for.
And we've had people make appointments at my office, and not many this year. I'll be honest with you. I'm not sure if everybody, it's been consistent with at least 535 people coming to the clinic for the last 3 years. And it's been consistent with people coming to the Board of Health for appointments as well, just to try to get rid of whatever flu vaccine we have left over. This year was a little, again, because of COVID, I'm not sure, if that stopped a lot of people from doing that, getting a flu vaccine, or maybe they did go somewhere else, but those numbers for appointments at the Board of Health after the flu clinic were very, very low.
And they usually are. So usually we have the flu clinic in October. That's where we give out most of the vaccine. It's been consistent, the amount that we've given out. Even, last year we had a ton of dispensers. We still gave out the same amount that we gave out in previous years. So we weren't able to book any more appointments. I think those people who come to the Board of Health for their flu vaccine, they're consistent. We usually get the same people, I think, every year who come here to get it. And that number hasn't really changed significantly from year to year. So the purpose of this is just to kind of inform the board as to what we were thinking about pre-ordering, and also to get an idea or thoughts from the board as far as where do you want to go with flu vaccinations. We've heard in the past from board members, let's concentrate on the EDS, and that's what we're sticking to here. But if the board wants to increase that, wants staff to spend more time on giving out flu vaccines and having flu clinics, then we just need to know that. And I would also have to go back and take a look at our revolving account and how we're spending out of that. But I wouldn't recommend pre-ordering any of this because I just wouldn't want to get stuck with it if we weren't able to give it out, because a lot of years we're just not able to give it out. That's why I like the reimbursement aspect of it, because we can, then use the money the following year.
So from my perspective, and my personal perspective, I think the way we have, since I've been on the board, the way we have handled flu vaccines, I think is spot on with strategically where I think we need to be. I don't want to become a weekly flu clinic for everybody. That's not where I think we need to be. However, I do think that we need to be a venue or an avenue for people that want the flu vaccine can show up and get the vaccination. Although they can, certainly it's available a lot of places, right? But we should be supportive of the community in giving out those vaccinations. So I don't want to run out if we are doing our flu clinic and then having the folks that want to get their vaccination at the Board of Health to come to the Board of Health and get their vaccination from Burlington. So I think that's at least personally my philosophy around the vaccinations. And as long as we have enough to support that and we're not turning anybody away that fits within that criteria, and we don't have a crystal ball, right? So we can't necessarily predict, but I think we have a lot of experience under our belts and understanding it. And certainly COVID has changed that a little bit. But I think we've done a good job, and I think we have a history under our belts to know what we're getting into for next season, ahead of the season that we're in. And it seems like you put a lot of thought around this, so I'm supportive of it. I just don't want to get into a predicament where we have run out, we don't have enough for the flu clinic, and we're turning people away. And I know it's hard to predict that, but that's kind of my. And I don't know if Andrea or Dr. Saltzman has any other comments to that, but I think that's directionally where I'd like to see this to be.
So for my benefit, where I am new, Susan, can you say who the intended audience is for the dosage for the 740 that we have planned or to purchase? Who is this intended to go to?
Sure. So we usually give about 50 or so to emergency responders. So that's our police and fire department. And we do that earlier than the flu clinic. So we'll do that before we have the actual flu clinic. And then the other, of course, the 60 flu zone that's for the 65 plus. So that's for the seniors. And then the rest is just, if you want to look at the charts, it shows on there the mixed age of what we've given in the past. And so it's the emergency responders and then the 550 or so people who show up for the flu clinic. We don't do a lot of vaccinations prior to the flu clinic because we want to make sure we have enough. And then so we'll do the flu clinic, and then whatever we have left over, we might do extra clinics on there. But we kind of have seen in the past, there's not a lot of people coming out. I think one year I did see, people were calling a lot about flu vaccine because it was on the news that it was going to be a really bad flu season, and everybody wanted their flu vaccine. That's very rare. I haven't seen that. I think I saw that maybe 2 seasons, maybe 1 season, in the past 12 years or so, where that happens. So that doesn't happen too often. And that year, we still were able to purchase some flu vaccine later on in the year. It just wasn't like a pre-filled vial. It was something else, but we were able to purchase it. It just wasn't what we normally purchase.
Yeah.
So, yeah.
Thank you.
Wayne, anything else from you, or are you good? Good.
No, I think we're a fairly well-oiled machine at this point with regard to influenza and the reasons that we support the emergency disaster arena is to continue to empower our medical reserve corps to develop muscle memory for if anything in the future should occur that requires emergency disaster training. So that's why we brought this in play. I think it's still valid today, and I thank our board nurse, and I'm appreciative that our director continues to lead us with such wisdom. So thank you.
I agree. Susan, do you need, you don't need a vote. I think it sounds like you support it. We're supportive as a unity towards and Chris, what you guys are doing for this flu clinic. So I think.
Yeah, thank you.
Okay, great. And if there's no other discussion, Dr. Weiner, if you're back, I'd be happy to turn the gavel back over to you.
I'm there.
There we go.
Good.
Welcome back.
Staff reports. Our environmental engineer is ill. Could I please have a motion to postpone her staff report?
So moved.
I have motion by
Second.
Dr. Saltzman, second by David Sweeney. All in favor, David Sweeney?
Aye.
Dr. Wayne Saltzman? Andrea Sheehan?
Aye.
And I vote aye, 4-0-0. Supervisory nurse. You're back on, Christine.
Hi.
Hi. Is there anything you'd like to highlight?
Basically, I'll just let you know we're working on the bladder cancer screening for the firefighters again. It will be hopefully the last week of March. I've just confirmed that with actually an email just now from Mrc. So that will be the last week of March for our bladder cancer screenings for the firefighters. And pretty much that is all I have for right now. Just kind of winding down, getting right back into the job swing of things versus COVID. So trying to get updated on everything. We did re-enroll in our VFC program, Vaccine for Children program. So we are all set and ready to go with that. We seem to be having a lot more immunizations coming through, so that'll be great. Other than that, there's not much that we have going right now. We're
Mr.
still
Chairman?
doing blood
Go
pressure
ahead.
screenings and all sorts of stuff. And we're doing blood pressure screenings at the library 2 days, or one night and one day each month. And we're also doing it now on the Council on Aging on the last Wednesday of every month from 9:30 to 10:30. Other than that, just working on trying to get these bladder cancer screenings done.
Does anybody have any questions for our supervisory nurse?
Mr. Chair.
Please.
So, Chris, have reportable communicable diseases, I mean, has Maven been firing off this season, or has it been a relatively quiet season, akin to influenza?
So, believe it or not, I've had more Lyme disease than I had flu this year. But, a lot of the times flu's not reported. So, people go, they stay home. They don't go and get the test done. So it's not a confirmed case. So the flu numbers, I'm not sure. I mean, it shows, I think I attached the flu weekly report. So you can see for the state of Massachusetts how it's very low. And it's been very low to moderate throughout the season. And I'm not sure if it's because of, we're focusing a lot on COVID, or people just weren't getting tested and they ended up with COVID anyways, even though you can get both at the same time, which people should be aware of. So I'm not sure what it is, but as far as like foodborne illnesses and other communicable diseases, it's low. It's been low since COVID started. Yes.
Gear up for next year.
Yeah.
Thank you, Mr.
I have one question too. You do AED checks all the time. And I was just happening to go through my files and I noticed some of those machines are getting pretty old.
So we had the manufacturer come out in August. She came out and she and I, we'd had a little course that we offered employees to learn about the AED. We also went around to each of our 5 locations where we have our AEDs, and she does a complete checkup with those, and actually showed me how to do it. So I will be able to do those instead of having her come out once a year. I'll be doing that, but I do the monthly check. So I do go around to all the locations. I do check and make sure that all, everything is there, nothing's out of date. And then also that they're working properly and run it through each cycle. So
Thank you so much for
so
doing
far, so good.
Yes. Hopefully we don't have to use them.
I know.
Are there any other questions for our supervisory nurse? If not, I'll have to put a motion to approve.
So moved.
Second.
Motion by Dr. Saltzman, second by Andrea Sheehan. All in favor, Mr. McSweeney,
Aye.
Dr. Saltzman,
Aye.
Andrea Sheehan,
Aye.
and I vote aye, 4-0-0. Takes us to Associate Director of Public Health. Michael Green, how's it going? This is week 3 or 4. This week 4, I think, or 5.
It goes by so quickly, time flies when you're having fun.
Are you unpacked? That's the key.
We're getting there. We're getting there for sure.
Do you have anything in your report you'd like to highlight?
Yes, so I've been working closely with Christine Mathis, and we've gone through the applications for biosafety and hazardous material registrations, and now we're into the phase of inspections. So I've been learning those, and that has been a lot of fun.
You went to a Sarepta IBC meeting.
That is correct. We did a Sarepta IBC WebEx.
Oh, well, you did it in a WebEx, and that went well.
It did. It did. It was good for our community rep as well. And in addition to that, not on this report, but we are putting together a training for our community representatives to get them up to speed on exactly, you know, what the expectation is, why we have it, and how we go about getting those biosafety inspected.
Thank you. Does anyone have any questions for our Associate Director? Do I have a motion for approval?
Mr. Chair, no, I stepping back for 1 second. I don't have a question. I just want to make a comment that I did watch the spotlight on BCAT on our Associate Director, and if you get a chance to watch it, it's in our meeting documents. If you get a chance to watch it on BCAT, it was quite fascinating. So welcome, as we said before, welcome to the team. We're happy to have you here. So and I'll make a motion to approve his.
Do I have a second, please?
Second.
Yep.
Second by Andrea Sheehan. Now, for discussion, I introduced Michael Green to the town meeting last week, and I had the opportunity to stand up before town meeting and introduce him, and I think that went extremely well. So you're getting there. People are knowing who you are. So I have a motion, a second. All in favor? David McSweeney.
Aye.
Dr. Wayne Salzman.
Aye.
Andrea Sheehan.
Aye.
And I vote aye, 4-0-0. And last, we have the Director of Public Health report. Now, this represents both the health agent as well as the Associate Health Inspector. So we'll do the Associate Health Inspector first. Does anybody have any questions with the Associate Health Inspector report? Okay, I'll go to the health agent. Any questions, comments? I'll just say that our health agent, Marlene, did an outstanding job. She did an outstanding job presenting to the MRC, and soon that she will present, they have taped it, and she will present the food safety presentation through BCAT. It was outstanding, just outstanding. And if you have an opportunity to see it, when it's presented, please do. It was an extremely outstanding presentation. Any other comments? If not, I will now present the Director of Public Health.
Yes, thank you. So just a couple of things. First, I would like to request or just make the board aware that one of the things that we need to look at in the near future, not right away, but is the tobacco regulations. So there is some, Marlene had mentioned to me some changes she would like to make with regards to the signs and becoming more in line with the state regulations. And then so based on that, I reached out to DJ Wilson. I don't know if you remember him, but he works for the Mass Municipal Association. He's an attorney that works on the tobacco regulations. When we changed them the last time, he was very helpful. So he's been looking at the changes to the state regulations. So there's been some changes to the state regulations since we adopted our regulations. So I'd like to get our regulations more in line with the changes that were made at the state level. So I know that last time we had a subcommittee on those changes. I think it might be a good idea to do some sort of subcommittee to talk about them before we bring them to the Board of Health meeting. So I was wondering, Mr. Chairman, if you might be able to consider that for discussion to create a subcommittee for looking at possible changes to the tobacco regulations.
If anybody would like to be on that subcommittee, please let me know. I won't, unless you know right now. If not, please give me a call or email me if you'd like to be on that subcommittee. We've spent a lot of time on smoking. We've come a long way in this community to where we are. Many, many years we've worked on this. So we have a subcommittee to to amend it, to update it, I can, please give me a call, email me, text me, or say yes tonight. I can wait. Susan, I will let you know in the next few days.
Thank you. And I don't anticipate it's going to be as much as it was the first time. It's just a couple of things that I kind of think that, you know, a subcommittee should have input on prior to the board meeting. So I don't think it will be that long of a meeting.
Okay.
And then also too, I wanted to let the board know that one of the things that I've begun working on is a grant application. So NACCHO is giving out what they call Mrc Rise Awards, and they come in different tiers. So I'm looking at applying for the $25,000 tier award. The application is due March 5th. I'm looking at things like portable vaccine coolers, so carts, portable carts for emergency dispensing sites, some recruitment materials, some trainings for our MRC. So those are the types of things that I'm going to put into the grant application, and I will let you know how that goes. It will be due March 5th. So I've been spending some time working on that recently. And that's it. I think that's all the updates I have.
Does anybody have any questions? Okay, Susan, you and I have talked about this a number of times, and I think the board has to be aware of what's going on with banter by Piercing Pagoda. You mentioned my name, you mentioned the board, and what's going on. I know everybody received an email on this. Can you just let everyone know what's going on? And I just want to bring that forward. And I know that I warned you we need to do this, and we can even discuss whether we ought to vote on it or not. So please, Susan.
So a lot of times companies will come to us asking us about body piercing and tattooing regulations, the body art regulations. And in this particular case, this company does piercings for all parts of the body, not just the earlobe. So if you pierce other than the earlobe, then you need to get a permit from the Board of Health. However, there are zoning regulations with regards to body art. So body art is only allowed in certain zones, and that is up to the building department or the zoning enforcement officer, who is Mark Patel, the building inspector, with regards to where these particular businesses can locate to. So this company wanted to go into the mall. I think there was confusion here because when they call us and they say they want a body art permit, we say, well, where are you going? Do you have permission from the zoning enforcement officer to go there? Is it zoned? So the mall is not zoned for body art, so they can't go into the mall. So, but this conversation with this attorney was that his request was to come before the Board of Health to ask the board to change their regulations and allow piercings without a permit. And I tried to explain that even if that board did decide to do that, you couldn't locate into the mall because it's not zoned for that, and you should probably try to, you know, change the zoning somehow if you're looking to get into the mall, because we have no control over that. So after discussing it with the chairman, there really is no, we saw no reason for them to come before the board. Number one, it would not be protective of public health to allow this without a permit from the Board of Health. Number two, even if you did, they couldn't go into the mall because of the zoning issue. So this is the email that I sent to that attorney along those lines. If you have any other questions on that, I can try to answer.
I just want everybody to know that what we were talking about, what the email was all about. Susan, do you need a vote for support for this? Just in case you hear again from some type of a suit or some type that the board backed this statement, or do you just want to let it go?
I mean, I don't see a need to have any kind of vote on this. There really it's not something that I would recommend that would rise to the level of bringing to the board for discussion. And I would never recommend those types of changes to our regulations because I don't think that that would be protective of public health to allow those types of piercings without a permit from the Board of Health. So
I would totally agree with that, Susan. And
Likewise.
Mr. Chair, I think you did the right thing for sure.
Okay. Dr. Saltzman, do you feel the same way? You're on mute, Dr. Saltzman.
Yeah, no, I know. Yeah, no, I completely concur with our director. I would not entertain a vote on this.
Okay, thank you very much. Do I have a motion then to approve the Director of Public Health's report?
Motion to approve.
Second.
Motion by Andrew Sheehan, second by Wayne Saltzman, all in favor. David McSweeney,
Aye.
Dr. Saltzman,
Aye.
Andrew Sheehan,
Aye.
and I vote aye 400. That brings us to the end of the meeting. Wow, we did a lot tonight. We really went through a lot of very, very important material for this community. Is there anybody here, anybody on the board, any of the professionals, anybody watching who would like to make comment before we adjourn? I'm giving anybody in the community, anybody on the board, anybody to make comments. If not, do I have a motion to adjourn?
So moved.
Second.
I have a motion by Dr. Saltzman, second by our Vice Chair, Mr. McSweeney. All in favor? David McSweeney.
Aye.
Dr. Saltzman.
Aye.
Andrew Sheehan.
Aye.
And I vote aye. That's 400. Everybody, be well, be safe. And Dr. Saltzman, any comments?
Please, everyone, don't let your guards down. Just continue to be the good citizens you've always been, and please, 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 please continue to wash your hands.
Thank you. Good night, everybody.
Good night.
Good night now.